In the United States, almost 1 out of every 2 adults has at least one chronic illness. The most common chronic conditions are high blood pressure, high cholesterol, heart disease, arthritis, and diabetes. Studies show chronic conditions are more prevalent in aged Medicare beneficiaries, but depression is more common for disabled beneficiaries. In addition, chronic diseases are the #1 cause of death and disability in the United States, and 72% of Medicare beneficiaries have 2 or more chronic conditions. Treating chronic disease patients accounts for 75% of the nation's healthcare spending. Chronic care management, or CCM, is a solution that contributes to better outcomes and higher satisfaction for patients by providing ongoing support for chronic illnesses such as diabetes, heart disease, and depression. It involves working with a multidisciplinary team of healthcare professionals to coordinate care plans, medication management, and other resources to improve the patient's quality of life. Chronic care management is typically conducted through telehealth, remote monitoring, and other digital platforms facilitating communication between patients and healthcare providers. CCM aims to empower individuals to control their health and minimize the risk of complications and hospitalizations. Even better, a Centers for Medicare and Medicaid Services study proves that chronic care management works. According to their 2017 white paper, CCM saved an average of $74 per month per beneficiary. However, many patients require help between appointments to stay on track with their treatment plans. Therefore, the Centers for Medicare and Medicaid established separate payments and billing codes for the additional time and resources providers need to offer help between appointments. The problem is that 95% of physicians surveyed say they don't have time to address social and behavioral issues, such as loneliness or financial concerns, that could affect the health of their patients. In addition, 44% of qualified chronic care management patients only tell their doctor about their medical conditions and not other issues they face that could affect their health. These issues are significant because additional research finds that 80% of health outcomes are related to factors outside the traditional realm of healthcare delivery, including social, economic, and behavioral. Now is the time for healthcare organizations to present themselves as leaders in the next era of healthcare. Presently, only 20% of eligible physicians utilize the chronic care opportunity to educate patients about their chronic conditions and the many social and economic issues that affect them. FiMed Management created the Well Living Initiative Chronic Care Management Service to assist healthcare providers in enhancing the human connection with patients and improving care plan adherence. Our service improves care quality by extending your practice beyond its walls without increasing your workload. Patients receive a comprehensive care plan that supports their disease control and health management goals. In addition, there are monthly check-ins, and patients have ready access to their care team between appointments. Our dedicated healthcare professionals help patients stay on track and improve care coordination with more communication and management of care transitions, referrals, and follow-ups. Healthcare practices benefit too from offering WLI chronic care management. The Well Living Initiative team handles all administrative work and conversations with patients. Patients feel more connected and comply with their care plans. And finally, practices sustain and increase profitability with improved patient care resulting in higher MIPS scores. Here's what one WLI chronic care management patient said. "I didn't think anyone helped people that live in the projects. Thank you so much for taking the time to find me affordable medication." Another WLI chronic care management patient said, "I haven't eaten in 3 days. Thank you for hooking me up with the Meals on Wheels program. It is great to see that my doctor cares about me and connects us together." And yet another WLI chronic care management patient said, "I am a double amputee and would like to drive. Thank you for connecting me with an organization that can outfit my car with the necessary equipment. My doctor is the greatest for bringing us together." You too can achieve improved care quality and extend your practice beyond its walls without increasing your workload. Contact FiMed Management about their Well Living Initiative Chronic Care Management Service today.